Mr. President, I ask unanimous consent that we dispense with the quorum call.
Without objection.
Thank you, Mr. President. Mr. President, I'm here because I am absolutely shocked at what happened on this floor a little while ago. And I'm going to try to convey to my colleagues a sense of the urgency that I think this moment demands. And they apparently don't understand because our Democratic colleagues all voted to prevent us from considering this legislation. So let me start with the context that we're operating in, Mr. President, because it's unbelievable. I wouldn't think I would need to go through this, but just to be clear, we've been invaded by a potentially lethal species, a virus that is infecting Americans now by the tens of thousands, growing numbers every day. It's killing Americans, including in my state. We have infected people in every single one of our states, and the numbers are growing rapidly. In response to this threat, we've been taking progressively more serious measures because of the degree of the danger, the disaster, the illness, the death that we fear if we don't try to stop this virus. So we have gone to an extreme that I will just candidly acknowledge I never could have imagined. What I'm talking about is, among other things, the fact that my state of Pennsylvania and many other states across America, they're closed. I could never imagine that I could even put that sentence together. My state is closed. What does that even mean? I'll tell you what it means. It means it's not legal to operate a business in Pennsylvania. It's not legal to go to work in the morning, tomorrow morning at 8 o'clock. There's only a very small percentage of Pennsylvanians who are even allowed to go to work. We have shut down the state. I'm not talking about restaurants and bars and nightclubs. I'm talking about all businesses except those deemed essential and a very small handful of others. I'm talking about factories, distribution centers, warehouses, all kinds of producers, manufacturers, services, across the board. It's closed. So what does that mean, Mr. President? Well, it means an awful lot of things, but the most important thing that it means is that the guy who wakes up tomorrow morning and can't go to work, what's he supposed to do? How's he going to support his family? Because he can't get a paycheck. It's not that he doesn't want to get a paycheck. It's not that he doesn't want to go to work. He's not allowed. He's not allowed. So he's going to have no income pretty soon because guess what? The company that he works for is not allowed to have any sales. They're closed by order of the government. And it's not just Pennsylvania. This is, I think, more than half of all of our states at this point. More than half of the country, and the number's growing every day. So this guy, like almost everybody across my state, men and women, are beside themselves. They're terrified because they know they still have to put food on the table. They still have to pay the rent or a mortgage. They still have to clothe their kids. They still have all the ordinary expenses of living, and they're not allowed to earn a living because of the extreme measures we are taking to try to avoid an absolute catastrophe with this disease. So, Mr. President, that's why so many of us in this body have worked so hard for several weeks now, but very, very intensively in these last few days to try to deal with this fact that we have a potentially lethal threat and an economy that is disappearing. I mean, literally, the bottom has fallen out. It is going away, and that is enormously devastating to the people we represent. So we have quite sensibly said we need to focus on these individuals first. The men and women, the families that are, as I said, terrified, and understandably. So what did we do? Last week we passed a bill that went right at, first and foremost, the people most directly affected by this. Paid medical leave at full salary for a couple of weeks. Paid leave thereafter. Paid family leave if you're looking after someone who's affected by this, including if it's your kids, because they can't go to school because the schools are also closed. But that wasn't all we did. We also bumped up the federal share of our Medicaid program, the program that pays for health care for low-income and poor people. We increased the share that the federal government would pay for that. We increased food stamps. I mean, we were trying to find ways, and we did, and we passed it with an overwhelming bipartisan vote. That's done. That was last week. But we recognize that that's not enough under these circumstances, because not only, things just keep getting worse. So we took up the bill that we put on the Senate floor today. And this had a huge sections designed also to help these individuals, these families, these men and women who just can't even go to work. One of the things we did was we made the unemployment insurance program much more generous. We dramatically increased the payments that you're able to get if you're unemployed, because we realize there's going to be huge numbers of people who they're not legally allowed to be employed, in a way. So several $100s a week more above and beyond what's already there, that's in this bill that our Democratic colleagues voted against. Several $100s of additional every week payments to someone who's unemployed. But that's not all we did for individuals. We recognize that it's going to take a little while for those changes to work their way through the system. And so we said, what's the fastest thing we can do to get money in the hands of these folks, these poor folks who are wondering, how are they going to make the next car payment? And what we did was we said, we're going to send a check in the mail. That's what we're going to do. To low and middle income wage earners, a significant check. $1,200 per person, per adult. So a married couple would get $2,400 plus $500 for any children they have. So a married couple with 3 kids living anywhere in America who are wage earners, who had middle or low income, they get $3,900, $3,900. That's the check that would be arriving in a couple of weeks. If the check doesn't get there, let me just make it clear why. It's because our Democratic colleagues voted no. They voted against sending that check. We thought that was important, to get that in the hands of the people who needed it. But that's not all we did. We also felt like, we don't really solve this problem until we defeat the virus. We've got a health care issue at the heart of this. We recognize that. And so we have all kinds of provisions in this bill, and many of the provisions were priorities of our Democratic colleagues, because this was a bipartisan process from the beginning. They know that. Like the plan to boost unemployment insurance. And by the way, not just the payments were increased, but we expanded eligibility. We allow people to qualify for unemployment insurance who in the past have not qualified. People like self-employed folks who historically have never qualified for unemployment. Under this bill, the one that our Democratic colleagues voted against, they would have qualified. But as I say, Mr. President, we also focused on health care. And some of the things, 20% increase virtually across the board for Medicare payments to hospitals. You know why? Hospitals are in trouble. One of the reasons hospitals are in trouble is they had to decide to discontinue elective procedures. So those surgeries that you'd like to have, but they're not absolutely essential, they're not happening. Well, that's how the hospitals pay the bills, those kinds of procedures. And they're not happening because they need to keep the beds available for a surge, a potential surge, if it should happen, in coronavirus victims. So we recognize that 20% increase virtually across the board for Medicare. Big expansion in telehealth. Why is that important? So that you can get the professional advice you need without having to show up in an office and potentially infect a whole lot of other people. It's a no-brainer, right? A lot of money for some of the materials that we need to do the testing, tests themselves. Money to create the swabs that are necessary to get the sample to run the test. Free tests. It's all in the bill that our Democratic colleagues voted against. And that's not all. We have $75 billion for hospitals in other forms, other than other than above and beyond the 20% increase in Medicare. $75 billion. I can tell you for sure, every hospital in Pennsylvania wants that, needs that. Actually, I know that's the case for hospitals all across America, but our Democratic colleagues voted against sending $75 billion to our hospitals at a moment when they desperately need it. $11 billion for vaccines and treatment. Look, this is the ultimate solution, right? When we have an ability to treat this virus so that if you're infected, you're not really harmed because there's a medicine that'll take care of it. That's ultimately a really important goal. But we don't have that yet. We don't know what that is yet. We need to fund the research and development of that medicine that will turn this into a minor nuisance rather than a threat against our lives. And how about vaccines? One day we'll have a vaccine. I want that day really, really soon. And so we've got $11 billion in this bill to accelerate the development of therapies and vaccines. That would be the bill that our Democratic colleagues voted no on earlier today. $5 billion for FEMA Disaster Relief Fund because they've got all kinds of expenses that they're incurring as they try to address this. $10 billion to keep our airports open because they're not getting the revenue that they normally get in the form of the tax that's on a ticket because nobody's flying. There are no flights. There are no passengers. So there's no revenue. But we need to keep those airports viable for the moment we can begin our restoration, our recovery. So we've got $10 billion. We've got $20 billion for public transit. I've been hearing from the folks who operate the public transit across Pennsylvania. They've got the same problem everyone else has in one form or another. They're hemorrhaging cash because they're trying to pay their workers, but they don't have the revenue coming in. So we've got $20 billion to help out with the public transit, which is absolutely essential in our big cities, but it's vital all across our country. $20 billion. They voted against that. So we focused on individuals and families, first and foremost. We focus on what can we be doing, everything we can, many ideas from our colleagues on the other side about how we can improve our ability to defeat this virus. And yet there's another thing in this bill. The other thing in the bill is to make sure there's a job to go back to. For the men and women who wake up tomorrow morning and don't have a job to go to, when this finally passes, I think it'd be a good idea if the company that has been employing these folks still exists. Now, how's that going to happen when they are not allowed to have any revenue? They're closed. Well, we've developed a plan in this bill to address this. So it's really kind of two components. For small businesses, there's a program that has the effect, at the end of the day, what it means is the federal government is going to pay for payroll for small business. That's amazing when you think about that. Nobody's ever imagined this before. The federal government is going to pay for the payroll for small businesses as long as they keep their employees on the payroll. The mechanism is a loan, which they will use to make the payments, and then they don't have to pay back the loan as long as they did, in fact, keep their workers on the payroll. So we've offered, in this bill, to pay to keep people on the payroll of small business. And our Democratic friends voted no. No, they didn't want that. Now, for large businesses, we took a different approach. We said, all right, we can't actually pay for the entire payroll of the entire American workforce. That's like 150 million people. But here's what we can do. A big company, if it's solvent, if it's viable business, but it's in a cash crunch because, have I mentioned, they're not allowed to have sales. They're not allowed to have revenue. They have no customers. In many cases, if they could, I mean, the airlines, there's nobody flying. Think of hotels. There's nobody staying in hotels. But it's all across the entire economy. So what we did is we said, look, if you've got a viable business, we're going to have a program where we're going to lend you some short-term money, because this should not last long. You're going to have to pay it all back. But we want to keep you alive, this employer, so that when this is behind us and when we no longer have statewide shutdowns and when we're able to go back to work and go back to producing and living normally, it'd be really nice if these employers still exist. So that's what we created. The minority leader derisively called that a bailout, as he voted again, to explain his vote against this. This is not a bailout. It's ridiculous to characterize this. First of all, they have to pay back every dime that they borrow. Every dime. It's explicit in the bill, in the law, that there can be no forgiveness. None of this can be written off. The companies that borrow this money have to pay back every dime. And let me stress, this is not their fault, okay? You're operating a business somewhere in Pennsylvania, and the governor says, by the way, close your doors at 8 o'clock Monday morning, and you don't reopen them until I say. Now, look, I'm not trying to attack my governor. I understand why he's doing this. But the point is, it's not possible for a business to survive. And we're seeing this manifested, the sort of easy visual view on this that some of my colleagues have mentioned are financial markets, because they reflect what the world thinks about the future of our economy. And it's really, really grim. Some have suggested maybe we shouldn't focus on that. That's not the focus. That just gives us a reading of just how bad things have gotten. And it's really bad. And when my Democratic colleagues came down here and voted against all of these programs and all of these efforts to rescue American workers and families, advance our fight against this disease, and keep employers viable, I was just shocked. I just can't believe that they would do that they would come down here. And I can only conclude that they don't understand the urgency of this moment. I think they've got to understand the nature of the disease, the severity of the disease, what that is doing. Maybe there's a lack of appreciation for the fact that at the same time, our economy is being destroyed. Many of if they continue this obstruction and they refuse to let us pass this because they dismissively refer to keeping alive employers as a bailout, then a lot of these companies will fail and they won't come back. You don't just flip a switch and have a company that failed, that went bankrupt, and think you're going to turn it back on. It doesn't work that way. It could take years or decades to rebuild an economy. And that means how many millions of Americans lose out on so much opportunity, on so much of life. That's what we can't let happen. We've got to stop this as quickly as we can. And that means I'm convinced these three elements, focusing on individuals who are adversely affected, and now that's virtually everybody. We've done that massively, unprecedented scale in this bill. Focus on killing this virus, defeating this, developing the therapies, the cures, the ability to treat, the hospital capacity. It's in this bill. Look, there'll be more to be done, but for now, this is huge. And we got these ideas from Democrats and Republicans. We put them in the bill. And then finally, if it's a fundamentally solvent business, just an extension of credit for a few months, a loan that they have to pay back so that there's a reasonable chance they'll still be there. Mr. President, this is exactly what this moment calls for. This is what we need to do for our country. So I am hoping that our Democratic colleagues will frankly come to their senses and conclude and understand that there's no time for games here. This is getting worse by the day. We've got to act now. So I hope before the clock strikes midnight tonight, we will vote in favor of cloture on the motion to proceed, the procedural vote that allows us to pass this bill as soon as possible.